The best outcomes are always when you're addressing the underlying cause. So in this case,
Sometimes they linger. So when you and I do facelifts and neck lifts, we can actually see the remnants of these threads, which is annoying and not great for the patient.
and the key is just good counseling of the patients that they know what kind of improvement they're getting, or maybe there's someone that doesn't need much improvement, and then that's a great option.
What's interesting is that there is a ligament that sort of pulls down the tissue to create this crease, but
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
hello, this is Dr. Roy Kim, and I'm here with my good pal, Dr. Kristy Hamilton, and we both make up the beauty scientists. So how are you today, Kristy?
I'm great, and I'm excited about our topic, the jowl, the famous jowl.
Yes. So everybody asks us, yes. I mean, we were talking about this right before recording. Everybody's always asking us, okay, I have this jowl. I look older. How do we get rid of it? So we re-reviewed the anatomy and the literature, and we're going to come up with the non-invasive, less invasive, and most invasive ways to fix it. So just to be very clear as well as nerdy, this is the jowl. I'm pointing it out on my face, and technically it is the labiomandibular crease. What's interesting is that there is a ligament that sort of pulls down the tissue to create this crease, but it doesn't connect the skin to the bone. Weirdly enough, it connects sort of the soft tissue underneath to the bone. So to fully correct this crease, most of the actual non-invasive, less invasive surgical procedures are geared towards the skin, which is better for patients. However, there are some limitations. So, Kristy, in terms of the totally non-invasive stuff, how would you actually improve the jowl here?
So, got a couple options. One of them is a camouflage procedure. So, if you have a small jowl, we can actually do a little bit of filler, but I know that's a silver medal one. We're going to start with the bronze medal. So, the simplest ways, we can Botox some of the muscles. And I'm using my face and pulling the corners of my face down. You can do a little Botox in the depressor angulioris muscle, which is this one I'm demonstrating here, pulls the corners of lips down. You can also do a little Botox in the platysmal muscle that attaches onto the lower border of the face, and that relaxes. It allows everything to go up. You can put a little bit of filler in the jowl itself. Now, these are great options if it's not a big jowl. Once you have a big jowl, the non-surgical, it's going to be a pretty modest effect and probably not what patients are looking for. Light laser resurfacing, some of the chemical peels, any of the resurfacing modalities we talked about that yield a modest skin tightening effect, my favorite being CO2 laser. Those would be other options to tighten the skin and improve that area. And those are all non-invasive topics. So what about less invasive ways to improve the jowl?
There are a couple things that I don't recommend, and there are a couple things I do recommend. So the thing I do not recommend, but actually works, is surgical threads. So you can put in a PDO thread right around here, and it can pull it up. You have to place it carefully. They're relatively expensive with the problem of really not lasting that long, but they do work. Sometimes they linger. So when you and I do facelifts and neck lifts, we can actually see the remnants of these threads, which is annoying and not great for the patient. The thread can actually pop through the skin and erode the skin if it's not placed quite deep enough. So babbling about all these complications. This is why, as a plastic surgeon, we're not in love with surgical threads, but it is an option. Another way is to tighten the SMAS underneath, the structure that supports the actual face and the framework of the skin. All therapy does do this. You have to be careful because, again, if you blast the all therapy, it can actually scar your SMAS. But that is a sort of less invasive way of doing it. Finally, we can actually fill it with fat, which I think is a longer term answer. So it's a small procedure to actually harvest fat, filter the fat, and inject a little fat here. And again, we're sort of masking it. We're not really doing anything to actually tighten the skin. However, the nature of fat grafting is we can actually sort of dissect underneath this jowl, place some fat, and it's not full-blown surgery. It is less invasive, but since it's releasing part of that crease, part of that indentation, it is a little more than the non-invasive. It's not quite as much as surgery. I think the final touch would be something of some technology that tightens your skin from underneath. Face Tight, which is a pretty advanced way of essentially heating the face and heating the skin, will work. But again, I don't think FaceTite alone will fully remove the actual jowl, that indentation. I think it'll do more than non-invasive stuff, but not as much as surgery, not as much as a neck lift. So anything else to add in terms of sort of the less invasive stuff to help the jowl?
Oh, I agree that this is what we're looking at. It's like camouflage procedures and then modest tightening procedures, whether you're tightening SMAS or skin. And the key is just good counseling of the patients, that they know what kind of improvement they're getting, or maybe there's someone that doesn't need much improvement, and then that's a great option. And I'd like to echo what you said about threads. If it's something that a plastic surgeon won't do to themselves or their close family members, probably shouldn't do it yourself. So this is something that, you're right, it does work. Like, we've seen some really nice results, but just the way that it ages just doesn't go very well. And so that's something I personally will never do. I don't offer it in my office either. And finally, gold medal winner, surgery.
Yes.
Always the best way. So what are your favorite techniques for addressing the jowl surgically?
This is going to be slightly nerdy because obviously everybody knows, hey, we need to sort of like lift up the tissue here, and we need to sort of release the skin or dissect it to eliminate this area. The nerdy stuff comes into play when you want to actually pull on the SMAS as a plastic surgeon. Technically, that's a deep plane technique, and there are a couple ways of doing it. And Kristy and I are very familiar with it, including going underneath and pulling, just cutting it, plicating it or folding it onto itself, doing a combination of these procedures. A lot of times, we actually also have to do a neck lift because we want to get to the jowl from the front. In other words, we need to make a neck lift incision in your chin crease, tighten up the neck skin and neck muscles, and still go to this area here to release the skin so that it fully moves when we're doing a facelift neck lift procedure. And that is the best way to actually eliminate the jowl or make it look as nice as possible. And finally, fat grafting is always so key in a facelift. We will definitely fat graft it. Now, as surgeons, since we've moved the jowl so much, we can actually fat graft in a slightly different area as opposed to if we couldn't move the jowl. So this is why fat grafting is so powerful with a surgical facelift neck lift. Just filling in the area, hey, it works, but it doesn't work as well as we can move the area and fill in the area. That's a lot more powerful. Any other hints that you would add for our patients if they're going to just have surgery?
No, it's ideal. I mean, this is the only technique that's actually addressing the underlying cause. When I talk to patients, whether it's body, face, the best outcomes are always when you're addressing the underlying cause. So in this case, it's descent, it's sagging, and lifting those structures back up onto the face where they belong. And that's always going to yield the most natural long-term outcomes. So I completely agree with you. So consider the facelift, even consider the early facelift. If this jowl is really bothering you, it's becoming increasingly popular to do it earlier, so you don't have to go in for this big dramatic overhaul of your face. Just kind of tweak things to get everything up, high, tighter, back where it started.
Yeah, I totally agree. The earlier we can start off with skin tightening, other technologies, suppressing the frowning muscles and other things like that, the longer you're going to postpone the need for surgery.
Agree. Prejuvenation, as they say.
That's right.
Well, there you have it. This is everything about the jowl, what it is, how to improve it non-surgically, minimally invasively, or full invasive with surgery, which does win the gold medal in our discussion. Comment below. Let us know what you would do if you could have any of these options. Do you have a jowl? Does it bother you? Do you wish you could improve it? And we'll talk about it more, answer any questions that you might have. So thank you for watching this episode of The Beauty Scientists. I'm Dr. Kristy Hamilton with my colleague, Dr. Roy Kim, and stay beautiful.
Stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.